Metro Louisville is made up of 26 districts. This podcast gives you a chance to connect with your council member and learn about what's going down in your district.
Welcome to the District Download, and thanks for tuning in. I'm Kyle Etheridge, and today we'll be talking with the Director of Emergency Management Agency, or EMA. First, I'd like to welcome today's host, Councilwoman Madonna Flood. Councilwoman Flood is a founding member of the Metro Council and was first elected to serve in 2002. She's currently serving her fourth-year term in office. Welcome, and thanks for joining us.
Oh, thank you, Kyle. It's a pleasure to be here today, and I'm so excited to talk with Jody in just a few seconds. I'd just like the folks to know that I'm at District 24, and I have probably one of the most chopped up districts, but the best way to describe it is if you get off of 65 and Outer Loop, I have the south side of Outer Loop. It includes Woodland Manor neighborhood up to Blue Lick Road. Have the east side of Blue Lick Road till you get to South Park. South Park, I take in both sides of Blue Lick Road, get cut off again at Hillcross, go over to Preston Highway, have both sides of Preston Highway to the Outer Loop. Then I go down the Outer Loop, have the the south side of Outer Loop till you get to the Jefferson Mall area, pick up both sides, go into Old Shepherdsville Road and all the way down to Smyrna and pick up some of Highview, go all the way over to the Hurstbourne Lane area, go from Hurstbourne Lane to Bardstown Road area, and then the last portion of the district, when you go up towards Preston Highway, it cuts off at Oakland Drive.
Wow, that is a very chopped up district, so thank you for giving us a little brief overview of the area you represent. So now I'll just turn it over to you to introduce our special guest.
Yes, today's special guest is Director Jody Meiman. He is the Director of EMA Emergency Management. Can you give us a little description of what you do at EMA and how you got there?
Yeah, so thank you very much for having me. I really appreciate it. Looking forward to this morning. So I spent 24 years in the fire service, retired as a battalion chief with the City of Louisville Fire Department, and also spent 24 years with a smaller volunteer department on the southwest part of the county. It was the Lake Dreamland Fire Department, which is now absorbed into the Pleasure Ridge Park. So grew up with it. My father was a firefighter, and now my oldest son's a firefighter. I think the other two boys are going to follow in those footsteps. So it's just been it's been a part of my family for a long time. And when I retired, I was gracious enough to get the opportunity to come to EMA as the deputy director and work with Debbie Fox. And then a few months after that, she was able to get another position with Bellarmine University, and I guess right place at the right time. And I was offered the position, and Mayor Fisher swore me in June of 2016. So I've been the director there ever since.
What departments do you fall under emergency management?
So we're a very diverse agency. Not only do we have emergency management, all 120 counties in the state of Kentucky have an emergency manager. That's me, and a deputy as well. Kelly Jones is my deputy director. He spent 30 years with the police department. So we also have the 911 communications center. Every 911 call in Jefferson County comes into our center. Very busy. I think we're going to talk about that a little bit later. We also have Louisville Metro EMS falls underneath us. Special events, every special event in Jefferson County is permitted through our office. So anything from a mom and pop walk in a park to the Kentucky Derby itself, everything is permitted through us. And as we know from the Las Vegas shooting in 2017, that everything changed with special events. So they gave it to us as the lead coordinator to help with all the safety and security with the special events. 311, which I know is very near and dear to all the council members' hearts. It's one of the big things to get things done in your all's, or one of the big ways to get things done in your all's district. So we're very proud of 311. We also have our mental health diversion program that we just started. So that is something that's it's still in a pilot program. Anybody that calls 911 that has a mental health crisis between a certain hour period, like I said, it's a pilot program. We want it to be 24 hours eventually, but it's one of those things that somebody calls that we have behavioral health specialists sitting in the 911 center. They can send it to them, and instead of sending the police to a call, they can actually get in touch with them, and then we can have mobile crisis responders actually go to them in the field. So, like I said, we're a very diverse agency in what we do.
Yeah, and I think that people are hearing EMA a lot more in emergency management directors because of all the bad weather that's been across the United States and even disasters elsewhere. You always hear now it's not just talking to the police officer or the fire chief. It's let's talk to the emergency management director and see where we're going from there. So I think out in the public, they're hearing that position a whole lot more than we used to.
Well, and it's one of those things that we're not necessarily in charge. If it's a police, fire, EMS incident, they're the lead agency on it. We're just the lead coordinator. So we come in, especially when there's multiple agencies on the scene, and help coordinate that incident to make sure that everybody's talking on the same page. We're getting information out with social media now. That's a huge thing with information to the public to make sure that everybody's getting that out and it's consistent between agencies. So who's going to be the lead on that? We set up a joint information center. So like I said, we're not in charge. We're just the lead coordinating agency in a lot of these larger events.
Yeah, and I think a lot of times that's one of the most important things, that everything is coordinated, because I've been on, in my other life, being out in the public, when there was a fire at a property, it was watching the police and the fire trying to work together to make sure that things go accordingly and that nobody else gets hurt.
Right, exactly. And everybody's got their role. It's just like I said, and after 9/11, we realized, because there was a lot of communications issues there between agencies. So there was a lot of federal grant money to put consolidated 911 centers together, everyone on the same radio network. So like in Jefferson County, we're 100% interoperable in our radio system. So there's been a lot of investment. There continues to be a lot of investment. So like I said, there's just a lot of things going on.
And speaking of, we have some more severe weather maybe coming into the Louisville area. We're fast approaching that. It's actually severe weather preparedness, not a couple of weeks ago?
Just a couple of weeks ago.
Yes, and one of the main responsibility of EMA is the severe weather alerts. And could you tell us, the public, what they should know about weather preparedness and about survival kits and things? I think this last big storm kind of caught us a little bit off guard as citizens, not being as prepared as we probably should have been.
3 words: do it now.
Yes.
Prepare now. And ironically, that event happened that Friday evening. Just 3 days before that was the kickoff to Severe Weather Week. So we were really preaching to people, hey, sign up for our Lens Alert, our Louisville Emergency Notification System. You can sign up for which alerts you like to, you want to get. Have a preparedness kit inside your house, a survival kit, because a lot of people lost power for 5 and 6 days. So they weren't able to utilize the food that was in their refrigerator. They had to use the food that may have been in their pantry, how they were going to cook that, whether they were going to eat it, straight from cans or go to restaurants. And a lot of people can't afford that. So they've got to have, that plan. But, the biggest thing, and we used to say the spring and the summertime was our severe weather, our bigger severe weather event seasons, but now it's any time. We had the Mayfield or the Western Kentucky tornadoes, and that happened in December, and then just in January after that, there were several other tornadoes that happened throughout the state of Kentucky. So you never know. But like I said, the biggest thing is do it now. Prepare now for, what you're going to do, what your family's going to do if you lose power. If you get trapped, if you go to the basement for a tornado and you potentially get trapped down there for several hours, maybe even to several days before people can get to you. What are you going to live on down there? Where's your safe place at? So, and then communicate that with your families.
What would you put in your survival kit? Can you give us a little hint? I know when you mentioned cans for food, the thing that popped in my mind is I call it a can opener key, the old crank top, because a lot of people have electrical things, so you don't forget. Things aren't pop top
Right.
like they used to be. All of a sudden now things are going back to you need it. You need a can
things that will last for a while that you can put down there, and it can be okay for several months. So you can go get your survival kit together today, put it in your basement or put it in your safe place, and then it'll be there. And then set your alarm or some type of reminder on your smartphone or whatever you may have to go check that every 6 months. But like you said, though, put a can opener in there. It doesn't do you any good to have cans in there with food in it that you can eat if you can't open it. So, plastic forks, you always want to have some type of charging device potentially that you can charge your smartphones if they do run out, if you do lose electricity, blankets, flashlights, things that are going to keep you safe in case you get stuck in a certain place for a long period of time.
And I have always heard doctors say that you should have some of your, if you're on prescription medication, especially if like for blood pressure, that you have some of that in your survival kit also.
Right. Keep that. Obviously, that goes bad after a certain period of time, but keep a few days worth of that in your survival kit, especially if it's medication that you have to take on a daily basis or several times a day. So keep a couple of those, and I always try to tell even my family, make sure your medication's updated. Don't just wait to the last day or the last pill in your bottle to get that updated, so that you have a couple just extra in case something like that happens. Something simple that we think about and we learn from a lot of these larger events is just memorizing phone numbers in your phones, because people pick their phones up and they say call mom or call dad, and then if I need to use your phone because mine's dead or I can't find mine and I need to communicate with family members that I'm okay, I don't know what mom and dad's phone number is. So just memorizing close family members' phone numbers is something that we try to talk about now that years ago we never really thought about because we relied on technology.
Yeah, I can attest to that. So I get calls all the time, or my husband will say, "What's so and so's phone number?" And I'm like, "You need to really write that down and put it in your wallet
Right.
if you're not gonna if you don't want to remember it, just in case."
I've got them in my phone, and I'm like Rain Man. I still type the numbers out, and my wife says, "Why don't you just say call?" And it's just, I don't know. It's just the goof in me, I guess.
Yeah, and I told my son this. I said, "You need to make sure that you have insurance cards also in your emergency kit." I don't leave my house on vacation or anything, but unless I make sure that I have my insurance cards because you never know.
Right. At least copies of them.
Right.
At least some type of copy of vital information that you may need if you get caught or have to go to the hospital.
And I signed up for Lens Alert when it first came out, and I really liked that because it lets me know inclement weather that's coming in, or if there's been a spill. I actually got one for a gas station that had someone had pulled their car away and had left the gasoline spilling into the parking lot, and I got a Lens Alert about that. Can you tell us how to sign up for Lens Alert?
You can go to you can go to our website, emergency management, or you can go to louisvilleky.com, and there's a banner at the bottom that you can sign up for Lens Alert. You can also text Lens Alert to 67283. That's our special number, and we use that number as well for our larger special events. So you'll hear us publicizing that with Thunder, Derby, and the Oak, or Derby festivals coming up. So you can text Thunder to 67283 and receive emergency notifications if you come downtown. If you're going to Derby, we do it for Derby. Text Derby to 67283. So all of our special events, we use that special number. But you can also do Smart 911. So there's an app called Smart 911. It's powered by a company called Rave Mobile Safety, and you can go inside of that, and it's really cool because you set your emergency profile up. When you call 911 from that device, your emergency profile automatically comes up on the call taker screens. So it eliminates vital time that they have to ask you questions because everything's already there. So it's proven to save lives in our center. We had a gentleman that was in a smoke-filled room. He couldn't get his address out, and all the call taker had to say was, "Are you at home?" And he was able to get yes out. She already had his address there, and she was able to get him help, and they actually rescued the person from the fire. So that's proven to save lives. And what's really interesting about that is that travels with you. So if you travel across the country, you go to cities that are powered by the same type of system, and there's many large cities throughout the United States that do. You call 911 in that city, it travels with you, and it populates on their 911 call taker screens as well. You'll also get their alerts in those cities as well, so you don't have to sign up for their specific emergency alerts. You'll get them if you're already signed up through Smart 911. So it's a really good program. One of the other capabilities that we have is what's called iPause. It's the Integrated Public Alert and Warning System that we can send out. It's the Amber Alert and a tornado warning that a lot of people don't know how to turn those off on your phone, which they shouldn't turn those off anyway. And we can send those out from our 911 center as well. So we can draw a geospatial area, or we can do the entire Jefferson County and actually send alerts to people just in those areas, and we don't have to, the people that aren't affected by the emergency don't have to worry about it.
Yeah, because time is of essence when there's a truly life altering event. That would save a lot of time because you would know a lot. You would probably know medications around that. Is that
Right.
correct?
And you can put your kids' information, your family's information in there. You can put, like you said, medications, medical problems. We used it during COVID to identify the people that couldn't leave home, and we had our food programs that were able to deliver food to the individuals that couldn't leave home because of that, and it was all because of Smart 911 and what they were able, that information that they were able to put into that.
And I think that's a great thing for all of us to put in our newsletters to send out to constituents, because that could save, like you said, it's been proven to save lives. So that's an easy thing to do.
And we'll actually come to your neighborhood meetings if you'd like, and actually bring computers for people if they struggle with computers and signing up. We'll actually sign them up at your neighborhood meetings and be able to get them, access to it right there.
That's great. That's really great. And talking about the 911 call center, was it last year you had 1.3 million calls?
Yeah, it was over that.
Oh, my Lord. Oh, my. Well, what happens and when should someone call 911?
Obviously, it's when they have a true emergency, and it's, and really what we have to try to, the way we treat it, and even when I was a firefighter, is no matter what you're responding to, it's their emergency. So you've got to treat it as such, because, that's in their eyes, it's an emergency. So, what we try to do, well, just to talk about the 911 center, like I said, it's the busiest in the state of Kentucky, just over 1.3 million calls in the last couple of years, each year. Talented group of people. We're hiring, so if anybody out there wants a good profession, we're short staffed. We're working on getting our people hired, and you can go to louisvilleky.gov and get an application and come join us. But they're a talented group of people. But if you think about it, the call takers are actually dispatch. They're taking 911 calls from the people's worst day. They're giving CPR instructions over the phone. They're giving delivery instructions for people that are pregnant that the ambulance hasn't got there yet. So we have a Stork Award that we give our people that actually give instructions for baby delivery. But when you call 911, make sure it is an emergency. We get a lot of calls, and I don't want to call it abuse, but it's people that may need medication filled. It may be people with very minor medical injuries. We've adjusted on the mental health issue, so we've got behavioral health specialists that are in the 911 center. Our plan by the end of this calendar year is to have nurses actually sitting in the 911 center that can further triage non-emergency EMS calls and potentially either get them a ride to an emergency room or to a doctor's visit, or we can send a what's called a community paramedic with our EMS to visit them to maybe take care of the problem. Maybe they just need a Band-Aid, or they just need something wrapped up, or they need an ice pack or something. But, instead of calling an ambulance or sending an ambulance, we can send somebody that can take care of it right there, and they don't have to worry about that. And then we can keep our ambulances more strategic for the higher type of emergencies for response in the county.
Yeah, and then I know from speaking with a doctor that I know that works in an urgent care center that people get upset if they come in an urgent care center and they are exhibiting life-threatening, like a possibility of a stroke or a possibility of a heart attack, and they really shouldn't go to an urgent care center.
No, that's when you call 911. I mean, when you have those experiences, and everybody knows what the signs and symptoms of a potential heart attack or a stroke, or especially even witnessing those on other people. So that's when you really want to call 911 and don't want to have to wait, because like you said, they do go to an immediate care center, and then they're going to have to call an ambulance there and transport you to a hospital. So if you have those immediate needs, you need to get to a hospital, call an ambulance.
Yeah, and don't waste time going
Right.
to. I don't want to say it's wasting. It is to me. It's wasting time if you're going to go sit someplace else when you get there after you drove 20 minutes or so, and then wait for an ambulance to get there. So
Right.
you've killed some time that may be essential for saving your life.
And we're a busy system. If you think about over 130,000 EMS calls countywide, that's with all the agencies, not just Louisville Metro. So we're a very busy system. So to eliminate those non-emergency types of calls, we'll keep those ambulances available for the more urgent needs.
Some really great information.
If I can just interject for a moment, can you go over to what happens when someone calls? Because frequently you'll call 911 and you might get put on hold, or they're not able to answer immediately. Can you talk about that a little bit and why you shouldn't hang up when you do that?
So we staff our 911 call center due to our peak times. So we have more during the day. We have peak hours from usually 10 in the morning till 10 at night, so we staff it accordingly with that versus the nighttime where we don't have that, as many calls. So, and that's a good question because a lot of people call 911 and they think that they're being put on hold, and it's really not. They're in a queue, so they're the next their call will get to the next available 911 call taker. So what happens is when people get that message, and it's really just a pre-recorded message that we have, and the first thing it says is don't hang up. And what do you think everybody does?
They hang
They hang up. And then when they hang up and they call back, you're really going to occupy two 911 call takers because your call is still in that queue. So it's still going to go to the 911 call taker at the next available one that becomes available. So when they get there and you've hung up, they're going to call you back. And then you're already in queue again. So you're going to occupy another 911 call taker. So we always tell people, stay in that queue. You will get to the next available 911 call taker when they become available. So it's a great question, and it's a great, thing to think about because we do get a lot of calls and a lot of complaints about, hey, I was put on hold with 911, and you really aren't. I promise you, they're in that queue. We just went live with a new $23 million program with our computer-aided dispatch. So we replaced all the technology in the 911 center. It's been the system that we went from. It was, the support was bad. It was just a system that couldn't take us into the future. And now we've got Motorola Solutions and what they call Premier One CAD. That's the name of the product. So we're really excited about that. And then we also went live when I mentioned that nurse triage program earlier. We've got a new emergency medical dispatch that we went live with a couple weeks ago that will help with that program as well. So when we get the nurses in by the end of the calendar year, hopefully we'll be able to streamline a lot more of those EMS calls.
I think Louisville's very fortunate to have such a professional group of people working through emergency management and through 911 and everything that it entails because everybody works so good together.
I couldn't ask for a better staff. I've got an assistant director. I mentioned Kelly Jones earlier, 30 years with the police department. I've got an assistant director over each one of the each one of the sides of the agencies. Angie Downs, she's been a dispatcher in dispatch for 27 years. Jesse Yarborough's our chief of EMS. Doug Sweeney came from the police department. He runs our special events. Michael Bennett runs all of our HR. Trevin Hunter, he's the assistant director over all of our communications and technology. So, and I've got a new public information officer, Jessica Wellington, that you may have heard of. She came from Mayor Fisher's administration, and she's we've had already so many things happen just since she's came in, and she's done a great job, with all of that. And not only on the public information side, but we really have tasked her with promoting our people. That's something that I think I've failed to do. We've done it some in the last 7 years that I've been there, but I really want our people promoted out into the community and what they do. And she's going to really do a good job and help us with that.
We just recently, we talked about this when it first happened, that with Louisville having a lot of trains that run through there and train derailment, what would happen if there was an emergency like happened up in Ohio?
So, it's on everybody's mind, and that's kind of the reactive society that we live in is people see things that happen and then they think, oh no, what do I have to do? And that's when I go back, going back to the preparedness, you need to prepare now. Don't just wait for something to happen and then, hey, it's on my mind now and I should think about what, and we've gotten a lot of calls throughout the community about, just what you ask about, the trains that go through. So, just to reassure everybody's mind, unfortunately, we've been experienced in train derailments because we had a large one in 2006 in Bullock County that a lot of us supported and went out there. And then we had a major one at the end of Dixie Highway in 2012 that was very dynamic. A lot of chemical was spilled. We ended up having an explosion a couple days later. Some people were burned. So, that was unfortunately a large incident. But, we've trained on these for years and years and years. The fire service has hazardous materials companies that train on it. There's 3 hazardous materials companies in the city of Louisville. There's 3 also companies in the suburban area that train in train derailments such as what happened up in Northeast Ohio. So, and not only that, but you've got fixed facilities. Those chemicals are going somewhere, and we've got a lot of fixed facilities in the area that could potentially cause a release or a fire that's out there as well. So, just prepare now. I mean, know what's around you. They're very safe. 99% of the chemicals that are carried on rail get there safely. So, that's a great statistic to give people a peace of mind that, hey, those things in Northeast Ohio don't happen all the time. And you've even heard just since then, there was a train derailment out close to Hardin County, I think, just in the last couple of weeks. It was a freight train, didn't have any hazardous chemicals that turned over. There was a couple other ones throughout the United States that you're hearing about that, they're on people's mind that, oh my gosh, these happen a lot, but they really don't. It's just that you're hearing about it because of the major one that was up in Ohio. So, but like I said, just to give the people a peace of mind, we train on this stuff. The local health department is our subject matter experts on air monitoring, so they respond with the response teams and do all the air monitoring. They actually make entries to do air monitoring with the hazmat teams that go in. So Louisville Metro Public Health, MSD is our regulatory agency throughout the county that responds with us as well on every hazardous materials incident. So there's a huge response group that will take care of these emergencies. And then if we need state and federal support, we go through state emergency management and can request those through them.
So I have a quick question. Excuse me. Just as a follow-up, so if there is an emergency like that and the public needs to learn about that and they haven't signed up for Lens Alert or some other kind of notification system, how does that information get disseminated to the general public?
So one of the big ways is we use social media. Social media can hurt you or it can help you, and we use it to help us. And it's that joint information center that I mentioned we set up very early into an incident, where whoever that lead is, they're the ones that are promoting that information that's going out to the public. And then everybody else, all the other agencies are just copying and pasting that. So it's the same message that's going out. If I need to touch people right now, immediately, I use that iPause alert that I mentioned earlier, the integrated public alert and warning system. So we can, like I said, we've already got it set up that we can do the entire Jefferson County, or I can literally on a map draw a geospatial area and connect everybody in there with the information that I need to get them immediately. We used it during COVID to initiate the curfews that we had in parks and other places that we were trying to keep people social distancing away. We used them during the protests because there were curfews there, so we used them there, but we used them in specific areas where there were people that we needed to depart and go home. We didn't use it for the entire county. So we've used the system, we've tested it. We do test it every month with the Federal Emergency Management Association. So that's a really good tool that we have and we purchased with our company that runs our Lens Alert.
Speaking of that, when the testing that we do, I think it's the second Tuesday
of the
that would be a good day for you as a reminder to look at your emergency kits that you have to make sure everything's up to date, and what's not up to date, get rid of.
And I'm glad you mentioned that too, because those are exactly what, the tests that we do every month are outdoor warning sirens, and they're just that. They're outdoor warning sirens. So don't expect that if you're in your basement that you're going to hear that. That's why we encourage people to sign up for Lens Alert. We get a lot of complaints that, hey, I was in my work, on the third floor of our building and I didn't hear the sirens go off. How do you expect me to get an alert if I can't hear the sirens? Well, they're outdoor warning sirens. So don't rely on those. We can also use those sirens if we need to promote some type of shelter in place or evacuation for a hazardous materials incident. We can pick which sirens we want to set off. And then what that's telling the public to do is, hey, there's some type of emergency that's going on around your area. You need to go to social media. You need to go to the television to try to figure out what's going on and see what actions you may need to do, whether it's shelter in place or evacuation.
Yeah, and I like that the national or when the weather comes across now, you can't change, you can't turn that off. It's on until you change a channel, that it stays there, so to make sure that you're watching or listening to what's going on in your area.
Right, it stays on, and that comes from the federal. That's a test usually that you see from the federal government, but we can initiate those alerts as well.
Sounds like we're pretty safe when it comes to being able to alert people.
Right, we are, and that but like I said, Lens Alert is only as good as the people that have signed up for it. So we're not happy with the numbers that have signed up. It's not because of our agency and a lack of trying. The council members help us out. They put it in their newsletter. They have us come to their meetings. It's just a proactive thing that we're trying to get the public to do. Like I said, I've got the peace of mind that I can do the iPause alerts in case I have to do that. But we really want people to sign up for Lens Alerts. And you can sign up for traffic emergencies. You can sign up for specific type of weather emergencies. So, but the tornado warning, it does come through the IPAWS, so that you're going to get that anyway.
And you mentioned social media and for kind of the general public who have not signed up for things. What's your handle or what's the best social media?
Emergency Services
Okay.
is ours. I'm not a social media person, so I don't exactly know the handle that it's called. But if they search for Louisville Metro Emergency Services, that'll take them to our Facebook, to our Twitter account. So, and we're getting involved in Instagram and some of the other platforms that a lot of our younger people are using as well. So, that's something that Jessica's done a great job and is getting out, and she's actually tracking the number of people that are following us. So we know that the numbers have already started to go up.
Great. And we'll also list that on the bottom of the podcast so folks can sign up for both Lens Alert and also follow you on social media.
Absolutely.
Oh, and the Smart app too.
Smart 911, yes, ma'am.
Yeah, that would be. I would sign up for both of them if I was the public. I mean, it's just going to help you. It's going to save times in emergency. I know that with an aging parent that we posted her medication on the refrigerator, because people get kind of emotional when there's an emergency and you're not thinking straight. And we actually had a EMT walk in and see it on the refrigerator and picked it off and took it with
Right.
him. And he was like, "This is the best thing you could have done for your parent."
Absolutely.
Is have that. But if we'd have put it on Smart, he would have already known it.
Well, and on Smart 911 too, one of the things that we can do a reverse query is if people put their health problems in there. So if they suffer from asthma, if they're on oxygen, and we have an incident or issue like we had a couple weeks ago with the windstorm that was out, we can go back and query people that may be on oxygen that may need help. If we need to evacuate people and there's people with special needs, we know that we need to go after them and actually specifically get them help. So, but they can put all that stuff in there, and then we can run a report depending on what emergency we have and see how many people are affected by that in that area and how many people we need to directly go after.
Yeah, so the best thing we can do as council people is help promote these again and again. It's never going to get a point in time that we don't need to remind people. We have new people moving into the areas all the time that you need to do this. This is something that's going to help you in the long run.
Right.
Well, great. Well, thank you both so much for joining us today. This has been such an informative discussion, and I feel like we're in really great hands with you leading the charge and kind of being the coordinator for emergencies. And Councilwoman, this was such a great topic, so I'm so glad that you invited Director Meiman here with us today.
Thank you all. It's all the great people that work for us. They're the ones that do it.
And I think I'd like to see maybe after we get everything going up with the mental health new bring it out into the public and not just the trial, but bring it forward to other areas. Maybe we could do this again and let people know because what that's all about.
Absolutely. It's in all 8 police divisions now. So we've grown. We started in 1 division and we've grown to all 8 divisions now. So we have made some really good progress. We're just trying to hire the right behavioral health specialists to be in the center as what we call crisis triage workers. So as soon as we get people hired, we'll be going 24 hours a day.
That's great.
Great. I'm looking forward to that discussion in the future as well. More information on EMA is available online at louisvilleky.gov. Just search EMA. And we'll be back on Tuesday, May the 9th for another special discussion. Until next time, thank you for tuning in.